Okay, now we're going to assess your ears. I'm going to inspect the outer aspects, looking at the placement of the ears and looking at the external canal for any inflammation, infection, or drainage that may appear abnormal. I can do the whisper test at this time. I'm going to ask you to occlude one side of your ear. Thank you. And I'm going to whisper a two-syllable phrase like mango or coffee, and then I'm going to have you tell me what it is. So,
Baseball. Baseball.
awesome. Normally I would do an inspection of the inner ear. I would get my otoscope and use the largest speculum that would fit comfortably into the patient's ear. I would pull the peanut up, and back, and I would insert the scope and look at the canal and finer tympanic membrane on both sides. I would look at specific structures of the tympanic membrane, including the bony prominences and the light reflex, assessing for redness. It should be a nice pearly white color. Then I can move to the nose. I'm going to inspect the external structures for any obvious like deformity or make sure that everything looks symmetrical. I can take my light source and ask my patient to flex their neck slightly for me so I can see up your nose. I'm going to take my hand and hold your nose up. I could use a speculum at this time and assess the mucosa, the septum for any deviation, looking for turbinates, looking for redness, polyps. I can test the patency of your nose by occluding one nostril at a time and taking a deep breath for me. Great. Okay. Then we can move to the mouth. I'm going to look at her lips, look at the structure for any cracking or sores that might be apparent. When I ask her to open her mouth for me, I'll shine a light and have her stick out her tongue and say ah. So open your mouth.
Ah.
Awesome. And then while I'm here, I'm going to look at her tonsils and I'm going to look at the uvula. It should be midline. I'm looking at the soft palate and her teeth, her gums, the mucosa, under her tongue, the roof of her mouth, for anything that might look abnormal. Her tonsils were like a 1+. They occupy like 25% of her oropharynx. Then I'll move to her neck, and I'm going to assess for alignment and symmetry, make sure that the trachea is midline and that there's no masses or lesions that I can feel. I'm looking for any pulsations or jugular vein distension. I can palpate her lymph nodes. I'll start on her face and I'll work my way down her chin, jawline to the tip of her chin, and then I'll work my way down the inside of her neck, and then I'll move to the back and slide down her neck above the clavicle. I'm going to ask her to turn her head to one side, and I'm going to feel along her neck on this side, and then we're going to switch. And I'm feeling when I'm doing this for anything that's like pea size or large, it should be mobile and non-tender for me. I'm going to palpate her trachea and displace it to one side and then to the other, and I'm going to note that it's midline. I'm going to palpate her thyroid. I'm going to move it from side to side. And then to check her range of motion, I'm going to ask that she tucks her chin and does a head roll for me and rolls all the way back. And then to check her neck strength, I'm going to ask her to press against my hand. Okay, press against my hand. The back. There we go. And the front.